Through research that was done actually here in Kenya over 5 years, we realized that urban dwellers were in a worse situation, public health-wise, than rural. And this kind of flipped the question for us at the Gates Foundation. People had assumed that rural areas needed more help, but actually the urban poor are having as many as 2 children more than they actually wish to have. So those statistics moved us to look more closely at the urban area. What were the challenges, and then what were the advantages? And some of the advantages are the fact that there are supply chains, there's media, there are political centers often.
The urban poor are really suffering, and they live in one of the most terrible conditions, because if you are in a rural area, at least you have a very fine environment in terms of aeration. There is no pollution, you know, there is no gutter running and mosquitoes. It's cleaner, it's far better. So these people are really a group that needs to be supported.
Urban poor people do not have facilities located near them that they feel comfortable accessing. Certain services that might be there may be unaffordable, and probably some urban poor people do not have the information and knowledge that they require in order to make an informed decision to go for family planning.
Evidence has shown that promoting family planning, or childbirth spacing as some call it in Nigeria, it's one of the key pillars for us to accelerate reduction of maternal mortality reduction and meet the MDGs in Nigeria. It's been shown that it can contribute at 25 to 30%, you know, if we pursue it vigorously and let the citizens of Nigeria understand the development of family planning to the environment and also to quality of life.
The reason is basically because of the structure of the Kenyan population. If you look at the population structure, almost more than half of the population of Kenya is below 15 years of age, and that is a year where we use that people move into reproductive age group. So very young, very big young population which moves into reproductive age group. This is a challenge and a strain and a burden to reproductive health services that we have in the country. So that makes it a big priority for our country.
Cela signifie que les gens qui viennent de la périphérie sont des gens pauvres, qui ne sont pas bien installés, qui vivent dans la promiscuité, donc qui n'ont pas accès aux services de base, y compris les services de la santé et de la reproduction. Si on prend garde, il risque d'y avoir beaucoup de mortalité aussi bien pour les mères que pour les enfants. Et ceci peut être lié au fait qu'ils n'ont pas les ressources financières pour le faire, mais également au fait qu'ils ne connaissent pas les milieux, qu'ils sont désarticulés, mais aussi qu'ils conservent certaines habitudes qui ont changé par rapport à la communauté urbaine. Donc eux, ils maintiennent les aspects socio-culturels de la communauté rurale.
The case of urban poor is more complex because of their levels of poverty and lack of information, knowledge about family planning, and also their level of vulnerability because they might be migrants, recent or long-term migrants in a particular area, or have moved several locations several times and do not have access to any committed specific family planning centers that they would be using. The situation can be different in a rural area where women will access government's primary healthcare centers where they live. With the urban poor, that's not the case.
Collectively and in partnership with others, we can work to solve problems that confront the urban poor, and getting them involved in the decision making and then taking ownership of that problem through networking and partnerships is probably the best solution we can think of for them.
We have 5 fingers here, and if you were to tackle anything, you could make little holes in something. But when we make it a fist, we can make an impact. So if we can all put together our synergies, we can make a difference. So be it at national level, be it at international level, or global level, partnerships will deliver.
The advantage of MLE is to be able to provide very systematic, comprehensive database on all aspects of both, not just looking at family planning use, but looking at consistency in family planning use, method switching, new acceptors, looking at attribution of improved contraceptive use. So I think as the data that will be provided from MLE is going to be able to give us clues to a range of questions that the field is grappling with in terms of what could be successful.
A été considéré par le bailleur comme un pays de référence. Nous allons mettre en place un système de travail en milieu urbain. Nous allons développer des outils et nous allons mettre en application ce projet et nous voulons partager le succès de ce projet au niveau de la sous-région francophone pour attirer l'attention des gouvernants de ces pays sur la nécessité de servir les pauvres populations vivant dans le milieu urbain.
Most of the cities in Nigeria, I mean, the urbanization is so rapid that there couldn't have been a better time for this kind of intervention, for this kind of assistance, this kind of support. And I think that every well-meaning Nigerian should welcome this initiative by the Bill Gates Foundation.